Donna, welcome. Thank you so much for joining us. Would you please introduce yourself and tell us about your role at Mount Sinai?
Sure. I'm Donna Catamero. I'm a nurse practitioner, and I'm the Associate Director of the Multiple Myeloma Clinical Research Program at Mount Sinai Hospital in New York City.
Great. Would you tell us about the currently approved CAR T-cell therapies and which myeloma patients they may be right for?
So currently we have two products available for patients. The first is Abecma, and it's approved for patients with relapse refractory disease who have received 2 prior lines of therapy. And this includes exposure to an immunomodulatory agent, so your Revlimid, your Pomalyst, a proteasome inhibitor, and that includes Velcade, Kyprolis, and an anti-CD38 monoclonal antibody. So this is your Darzalex or Sarclisa. The second product we have to offer patients is Carvykti, and this is approved for patients a little bit earlier on, so also relapse or refractory disease who have received at least 1 prior line of therapy, and it must have included a proteasome inhibitor and an immunomodulatory agent, and they need to be refractory to Revlimid. So what refractory means is that they relapsed while taking the Revlimid. And both these therapies are important for patients. So, if patients are inquiring about CAR T therapy, they should ask their providers, what product is available for them.
Let's talk about research in CAR T-cell therapy. What new options are being studied and how far along is the research?
So we're actually very excited. So the 2 products, Abecma and Carvykti, we're actually looking at them in newly diagnosed myeloma patients. And this is regardless if patients are eligible for a transplant or not. And we're looking at comparing transplant versus CAR T therapies. So we're hoping to move CAR T therapies for newly diagnosed, so first-line therapy. So this is very exciting. And we're also investigating new products with dual targets. So right now, our 2 approved CAR Ts, they target BCMA. So now we're looking at CAR Ts that are targeting BCMA and another target. So GPRC5D or CD19. So this means that the CAR T is grabbing onto more cells. So in theory, it would have a higher cell kill. And then we're also investigating CAR Ts that we call off the shelf, so autologous CAR Ts, so donor CAR Ts. And this is actually exciting for patients who maybe can't wait for manufacturing of their T cells, and now we can use donor T cells. So these are earlier on studies, so we're hoping within the next few years, more options will be available for patients.
What happens if the myeloma comes back after CAR T-cell therapy? What are the treatment options available beyond CAR T?
Earlier on, we were hoping that CAR T would be our cure, but patients are getting very long, durable remissions from their CAR T therapy. We see patients who are 5, 7, 8 years out from their CAR T therapy, so patients do have a long time in remission, but the myeloma can come back. What do we do with these patients? And we actually have been very successful in managing patients post a CAR T relapse. So we are looking at bispecific antibodies, which were recently approved over the past several years. And we see patients who've had relapses from their CAR T go back into a remission with these bispecific therapies, and again, have long, durable remissions. So we can absolutely manage patients if their myeloma comes back after a CAR T therapy.